President Obama's budget for 2010 includes a 10-year, $634 billion reserve fund to help pay for health care reforms. Joining me now, one of the leaders in the debate over that issue, Georgia Senator Johnny Isakson. Senator, is there the basis for a true bipartisan compromise on health care reform this year?
Well, unfortunately, what the agreement that I understand took place on Friday portends is that they'll do health care through reconciliation, which means they can avoid regular order. They don't have to get a cloture vote and could, in fact, kind of press on the Senate exactly what the administration wanted without debate. I think that would be a very bad way to handle what is a significant concern in this country.
Well, I don't want to get too far into the procedural weeds. What they're talking about is reconciliation. It's a way that this would be passed as a budget measure rather than a policy measure, even though it's obviously a huge policy measure, and therefore they'd only need 51 votes. But they say they will only use it as a last resort in October if they can't get a compromise. I guess the question is, obviously, they've got that hammer over your head. What is the possibility that all parties to this, Republicans, Democrats, health care providers, insurers, can all get together?
Well, I'm prepared, and I think a lot of people are prepared to come to the table and begin the talks and the negotiations. We have a working group within the Republican conference that is working on a plan to offer. You have the Wyden-Bennett bill, which is a bipartisan bill that's already been introduced in the United States Senate. There are a lot of ideas out there, and if we can have a good, solid debate and a good, solid give and take, we might can come up with a good piece of legislation. But if a hammer is used to force what the end result is, and the end result is a single-payer government system, that's going to be a problem.
Now, President Obama is talking not about a single-payer government system, but about a public-sponsored, government-paid-for health plan that would be in competition with private plans. Is that a deal-breaker?
Well, it portends certain problems. Number one, where have you ever seen the government compete with the private sector where it didn't have the advantage, both in that it doesn't have to pay taxes as well as it is the regulator? So you'd have to see what the meat on those bones is, but it could be very problematic.
So I get the sense you don't really attribute a lot of good faith either to the president or to his Democratic allies on this issue on Capitol Hill.
I'm not ready to accuse anybody of bad faith yet. I know Senator Baucus, the chairman of the Finance Committee, is working on a bill himself, which I think has some good ideas in it. As I say, the Wyden-Bennett bill has been there. The president's provisions in the budget are thematic without the details, and so we're going to have to get to that point. But I'm not going to get into accusing somebody of being disingenuous yet until we really see what the debate does.
And real quickly, we've got about 30 seconds left. I mean, this is going to be enormously expensive. As we said, they have a $600 billion placeholder, but they're now taking out, the Democrats are even, some of the ways to finance it.
Yes, but they're leaving in it a reduction in tax deductions of about 20% for those over $250,000, which is most American small businesses. They're talking about demanding bigger rebates from pharmaceutical companies. They're talking about hedging or carving out reimbursement for providers and doctors. They're nickeling and diming here, there, and yonder to come up with the money, but it still spends too much and forces us to borrow too much. We've got to find a better way to do it.
Senator Johnny Isakson of Georgia, thank you so much for talking with us about what's going to be the big issue perhaps in the next 100 days, the debate over health care.
Thank you, Chris.